and you decide to do 55 Ks. What's wrong with you?
You know, the same thing. A lot of people said the same thing to me. You know, I said, I remember when I told people I was going to do this, I was told silly, ambitious, crazy, moronic, whatever. And you know, it was a patient of mine. Her name was Ruth. She was 82 years old. And she looked at me in the eyes and she said, you know what? You got to do it. Because you got to let people know that those who have mental illness are not alone.
One out of 5 Americans suffer from mental health issues. Diagnosis of anxiety disorders is at all-time high. Post-traumatic stress disorders is all-time high. We're losing over 40,000 individuals from suicide in our country annually. The majority of them are younger individuals. Opiate addiction is rampant. It is an epidemic.
A friend of mine that I went to high school with and also served with was diagnosed with PTSD as well, and he actually took his own life about a year ago.
We actually have a child this past year that witnessed his sister who was murdered by a step-parent.
My dad, when I was only 15, took his life as a result of depression going along with addiction.
I have really been awoken to mental health depression issues in the last couple of months due to a family member. A close friend of that individual committed suicide 2 weeks ago at a very young age.
My mother's side has multiple suicides and endless suicide attempts.
It's pretty fresh. My father took his own life on May 1st of this year.
And I feel like it's very stigmatized and it's kind of kept under the rug, and people, I don't think people are as aware that it's happening at the frequency that it is.
When Charlie tells me I'm sad, I just feel sad on the inside, or I feel empty. And as a parent, I struggle with what to do and how can I help him feel better, and why can't I just give him something? There is no quick remedy.
Just please be there for your children. Don't never think it wouldn't happen to you. Pay attention to little cues. I never thought it was going to happen to my baby.
There's definitely challenges around pediatric psychiatry in terms of access, especially when you move away from the urban areas. Even within the city, the urban areas, access to a psychiatrist, a pediatric psychiatrist could be a month out, and the kid is in crisis today. So what do?
There are several children who are out there without a diagnosis who are suffering mentally. Their parents don't understand it because they're not educated, and there's nothing to do to help provide resources for the family, medically, for medicine, or for even an explanation of what the kid has.
I think one of the hardest parts of my job as a provider is to even be able to find the resources and referrals that they need to get long-term care.
We are constantly working to try to get good mental health for them, and it's, I think, harder than winning the lottery.
I'm really fortunate to work for a company that offers phenomenal insurance, so I'm really blessed in that area, but mental health is not part of the package.
I actually tried to commit suicide, and so I was institutionalized for 2 weeks. I knew it was getting worse, but I couldn't do anything about it because, well, I had no insurance. If you don't have insurance, I guess I can't go to the doctor.
So we called our family physician, and they couldn't see us for days. So for days he just told me how stressed out he was, and used words like I would feel like I want to blow my brains out.
So really the struggle is that you have a suicide and then you're having to wait for all of this.
Yes, I thought if you mentioned that on the phone to someone, they wouldn't see you in 48 hours, or they wouldn't tell you to talk about it and call back, that they would take action and tell me what was needed, instead of us having to go search out to see what we needed.
The length of time it takes for him to get to the point where he can get the resources, housing help, transportation help, regular follow-ups in order to receive medications. The length of time that it goes from when he's released to the time that he can actually, get established is so long that he slips and then he ends up back in inpatient psych again, or into the legal system again, which happens more frequently.
Opiate use is really big right now in Louisville.
A lot of the times we work with youth particularly, but we get to them a little too late.
And addiction resources, I think, are even less than our mental health services here in Maine. Really been trying to kind of up those, especially with the opiate crisis.
Well, the main thing being in West Virginia, that we have a huge opioid epidemic going on, that if a lot of people have been watching the news or documentaries, that we've been kind of the epicenter in one of the hardest hit areas in the country.
Where they go from after the hospital is the question, are they going to their follow-up appointments? Are they receiving the care that they need? That's the big question. I don't think so.
The same question that keeps getting brought up when someone is being discharged is, where are they going to go?
So they need to have somewhere where they can go and they can be kind of rehabilitated and work towards getting back into society and becoming a productive person, because I think that that's a possibility.
Because the other option was jail, and that's a bad option. That's a bad option, but sometimes it was the only one.
There's no hope in jail for these people, or prison. I mean, there's no mental health treatment really in prisons down here.
You have a lot of mandatory sentencing, so people who probably could do better with treatment really find themselves being incarcerated where they have very little access to mental health resources.
There are many people who are in jail who are waiting to get into our hospital, but they have to stay in jail until we have an opening.
I have decided that one thing I could do is to integrate my desire to bring awareness with that of the impact of running and physical health that has impacted my mental health, to pursue what I call the 5-50-50 series. There are many studies to show that running and exercise improve mental health, and in fact in some situations it controls the symptoms.
I had a close family member that committed suicide just a few months ago, and so when I was looking to try and help his children, I stumbled upon your mental health awareness run, and I said, let's do it, let's just sign up.
I myself battled with a diagnosis. I ran this run for myself, my friends, and my family who has a diagnosis.
I wanted to run this run because I have two daughters who have difficulties with mental health, two of which have tried to commit suicide. Both of them still here today. Very thankful for that.
I am a personal trainer and wellness coach for a nonprofit organization. So I work with a lot of members that have mental health challenges. I was like, you know what? I think my members might really get a kick out of training for that, having something to work for, something to train for.
We're running in honor of my uncle, Stephen Wolashik. He passed away during a manic episode. He unfortunately got hit by a semi-truck.
And I just want to spread more awareness for my friends, my family, for my culture, to be more open and to know that things do happen, but it's okay to talk about it. You're not wrong, and mental health is not dumb, and it's not something to just throw underneath the rug.
This is the first of 50 more races that we're going to do. We're running 5K in all 50 states in 50 days. Hawaii is the first. The next we're going to be in Alaska, and then after that we're going to go to Seattle, and then after that we're going to go to Oregon, and then cross over the country. In my dream and hope that at some point mental health coverage will be at parity with all the other coverage. You know that from your social activities. I mean, if you have cancer, God forbid, you will be taken care of.
Right.
You know, your
And
insurance
it's not
will figure out.
stigmatizing either. Right.
It is not stigmatizing.
Right.
And you could sit here and talk to me about your breast cancer or talk about your diabetes, but if you have mental health issues, it's a very difficult.
No one can feel your sorrow. No one can feel your pain. Though your tears soak the clouds and your fears, they shake the ground. When the sun goes down, you wanna cry. Another day's past, will it pass you by? In the morning, birds will sing, even if your sadness has no end. When your tears soak the clouds and your fears shake the ground, you are not alone. We are here, we are near. You are not alone. We are here, we are near. You are not alone.
You're not alone.
You're not alone.
You're not alone.
You're not alone. You're not alone.
You are not alone. You're not alone.
You are not alone. You're not alone. You're not alone. You are not alone. You are not alone.
There are tons of people suffering. Everyone is struggling with something, and you are not alone. And please reach out and please say something to someone, because there are people who want to help take care of you, and we're all working to take care of each other.